Multiple sclerosis, or MS, is an unpredictable disease of the central nervous system that causes a variety of debilitating symptoms. It affects over 400,000 people in the United States. Here today to speak with us about a new survey findings and how women can take charge of their MS is neurologist Dr. Laurie Travis and Ann Lee Gilbert from nonprofit organization Can Do MS. Dr. Travis, let's start with you. What is MS and who does it affect?
So MS is a very unpredictable neurological disease. It is an autoimmune condition. In other words, it is the body mistakenly attacking itself, and it affects women 2 to 3 times more often than men and can produce really unpredictable symptoms, sometimes numbness, sometimes visual problems, sometimes difficulties with walking or speaking.
Now, sometimes when women hear a diagnosis of MS, they're just, broken, heartbroken, of course. Why is this?
Yeah, that's a great question. Generally, the onset of MS happens between the ages of 20 and 40. And for women, this is a really critical period of time of where they're starting to plan for their families, their personal relationships, as well as their careers. So receiving a diagnosis of MS during this time can really stop women in their tracks and force them to really rethink of how they're going to change their future plans based on their diagnosis.
So when a woman is diagnosed with MS, what are her top concerns?
So Can Do MS worked with Teva Pharmaceuticals to create a survey to 1,000 young women who are diagnosed with MS. And what we learned from that survey is that an overwhelming 98% said that their concerns surrounding family and career weren't addressed during their initial visits with their healthcare professionals.
So there was a recent survey conducted. What were the goals of this survey, and what are the outcomes?
So to me as a neurologist, I think the outcome really shows me that we always are working very, very hard as neurologists to do our very best for multiple sclerosis. And like I said, there's so many things that we can do now. But I think in medical school, we typically are trained to look at diagnosis and treatment. I think this brings an extra step into the picture where we hopefully can expand that conversation, especially with young women, to include family and relationships and those other really, really important parts of who we are.
What would you say is the significance of the survey findings?
So from my standpoint, the significance is that there really was a little bit of a gap between, I think, what people came in hoping that they could address and what they did address. So 71% said they would have been happier if they had spoken earlier and more openly with their physician. This is, to me, a sort of call to action, and that is both for physicians and for patients, coming into your doctor earlier if you have MS, reaching out to a physician, and making sure that you get your needs met.
Ann Lee, could you tell us what type of support and resources are available for those women who are diagnosed with MS?
Absolutely. Based on our survey findings, Can Do MS and Teva Pharmaceuticals created a list of resources for women with MS and for their healthcare providers to access. These resources can be found at mscando.org, and they include some tips for newly diagnosed women on how to live healthily with MS, as well as a list of questions that patients can take to their healthcare providers so they can really have those meaningful conversations and get to the root of some of their problems. And there's also a discussion.
And that was Teva Pharmaceuticals sponsoring that segment.